Welcome students. Today we are going to discuss about the dural folds and the dural venous sinuses. So we all know that the brain oda covering nu paakumbodhu dura matter, pia matter, in between the dura and the pia arachnoid matter. அப்படின்றத childhoodல நீங்க தெரிஞ்சிட்டு வந்திருப்பீங்க. So what is the characteristic feature of the dura matter in the brain அப்படினு பாக்கும்போது, so the cranial dura matter அப்படின்றது it consists of two characteristic features. One is the dural folds and another one is the dural venous sinuses. So இப்போ நீங்க இங்க பார்த்துட்டு இருக்கக்கூடிய இந்த foldsஆ பார்த்துட்டு இருக்கக்கூடிய charactersக்கு பேர் தான் dural folds அப்படினு பேரு. So இந்த cranial duraவை பாக்கும்போது the cranial dura matter consists of two layers. One is the outer end osteal layer and the inner meningeal layer அப்படினு சொல்லுவோம். So the outer end osteal layer it is nothing but the pericranium of the bone. The meningeal layer அப்படின்றது which covers the brain. So the end osteal layer என்ன பண்ணிருக்குன்னா it fused with the pericranium. So the endocranium is otherwise called as end osteal layer. It is fused with the pericranium of the skull bone and also it is fused with the foramen and sutures. இங்க எல்லாமே இந்த outer end osteal layer அப்படின்றது fuse ஆயிருக்கும். அப்படியே கீழ வரும்போது through the foramen magnum வழியா next this dura matter is continuous with the dura of the spinal cord. இந்த meningeal layerல நீ பாக்கும்போது என்ன characters form ஆயிக்குது அப்படின்னா the meningeal layers at certain places they are going to reduplicate. So there is no change in the end osteal layer but the meningeal layer is going to form reduplication. So அந்த மாதிரி reduplicate ஆகி certain areasல இது fold form பண்ணிக்குது. Why this fold is going to form அப்படின்னா because during movement அப்ப head movement அப்ப உள்ள இருக்கக்கூடிய brainம் shake ஆகும். So அப்படி shake ஆகும்போது இந்த outerஆ dura matter இந்த dural ஏரியால meningeal veins அந்த மாதிரி நிறைய veins பாப்பீங்க இல்லையா, they are thin walled இருக்கும். So due to the shaking இருக்கும்போது இந்த veins எல்லாம் they are going to rupture. So to prevent that rupture, to prevent the hemorrhage, the folds எல்லாம் they keep the brain in position. So for that purpose the dural folds are going to be formed. So what is dural folds? They are nothing but the reduplication of meningeal layer of the cranial dura matter. Then what are the folds அப்படினு பார்த்தோம்னா one is the fox cerebri and another one is the fox cerebelli, then tentorium cerebelli, then the diaphragma sella. So four dural folds popping. First a sickle shaped dural fold which project into the longitudinal fissure of the cerebral hemispheres and which is attached above to the superior sagittal sulcus of the cranial vault and anteriorly it is attached to the frontal crest and the crista galli and posteriorly it is attached to the one straight line. This fox cerebri is attached with the tentorium cerebelli posteriorly. So this sickle shaped fold is otherwise called as fox cerebri which separate the two cerebral hemispheres. So ஒரு anterior end ஒரு posterior end, ஒரு attached margin ஒரு free margin. Attached margin is going to attach with the superior sagittal sulcus of the cranial vault and posteriorly it is attached to the tentorium cerebelli and then anteriorly it is attached to the frontal crest and the crista galli. So in the attached margin la ஒரு character இருக்கும்போது that is the superior sagittal sinus and the free margin la ஒரு character இருக்கும்போது that is the inferior sagittal sinus. These are all the dural venous sinuses. So எப்படி இங்க fold னு ஒரு special character இருக்கோ அதே மாதிரி இந்த sinus ன்றதும் ஒரு special character. So what is sinus அப்படினு பார்த்தேனா so meningeal layer reduplicate ஆகி folds form பண்ணுது அப்படினா மற்ற இடங்கள்ல எல்லாம் the end osteal layerம் meningeal layerம் they fuse with each other, அங்க செப்பரேட் ஆகி இருக்காது. ஆனா certain places where this dural venous sinus is present அந்த ஏரியால எல்லாம் there is a gap between the end osteal and the meningeal layer. அந்த கேப்ல இருக்கக்கூடிய ஒரு ஸ்பெஷல் கேரக்டருக்கு பேரு தான் dural venous sinuses. So இந்த fox cerebri-ல நீங்க பார்த்துட்டு இருக்கக்கூடிய venous sinuses என்ன அப்படின்னா இந்த attached marginல ஒரு venous sinus இருக்குது, that is the superior sagittal sinus. இந்த free marginல ஒரு venous sinus இருக்குது, that is the inferior sagittal sinus. So இந்த fox cerebri மாதிரியே next உள்ள posterior cranial fossa இருக்கக்கூடிய another fold வந்து fox cerebelli. அப்போ the name வச்சு என்ன சொல்லலாம், that fox is related with the cerebellum. So from the internal occipital crustல இருந்து it is project into the cerebellum. So it divides the both cerebellar hemispheres. That's all. Then the third one is the Tentorium cerebelli. This Tentorium cerebelli, it is act like a tent. So it roofs the posterior cranial fossa, and this separates the supratentorial compartment structures from the infratentorial compartment. So in the Tentorium cerebelli oda important characters என்னன்னு பார்த்தேனா, it has one free margin and one attached margin. So by what is the attachment of this free and attached margin nu pathena, this free margin it is going to form one gap. This gap is otherwise called as tentorial notch. The anterior end of the free margin is attached to the anterior glenoid process, and the attached margin is attached to the superior margin of the petrous part of temporal bone, and the anterior end of this attached margin is attached to the posterior glenoid process. So the free margin oda anterior end is attached to the anterior glenoid process, and the attached margin of the anterior end is attached to the posterior glenoid process, and at one place both this attached margin and the free margin are crossed with each other. Here there is one important structure lies, that is the third, that is the oculomotor nerve. So this tentorial notch, it separates the cerebral hemispheres from the cerebellum. So இந்த cerebral hemispheres ஓட weight போய் cerebellum மேலே விழுந்து அதை compress பண்ணாமல் this tentorium cerebelli is protect the cerebellum from the weight of the cerebral hemispheres. Next வந்து what are the margin பார்த்துட்டோம், அதனோட anterior and attachment பார்த்தோம். posterior பார்க்கும்போது this tentorium cerebelli is attached to the posterior end of the fox cerebelli. So இந்த straight lineல ஒரு sinus இருக்க போது, அந்த sinusக்கு பேரு straight sinus. So in the next slide you will see clearly. See, this is the tentorium cerebelli once again. This is the free margin and this is the attached margin. Here this is the free margin and this is the attached margin. So free margin or the anterior end is attached to the anterior glenoid process, and the anterior end of the attached margin is attached to the posterior glenoid process, and where it is attached அப்படினா on the superior margin of the petrous part of temporal bone. This is the petrous part of temporal bone. At one area both the margins are cross with each other. இந்த இடத்துல தான் oculomotor nerve is going to cross. Then this tentorial notch அப்படின்றது, it is another important question. So this is the tentorial notch. Through this notch the structure, that is the midbrain, என்ன பண்ண போகுதுன்னா it goes downwards. Then the oculomotor nerve, it emerges from the pons and it is cross this attached and free margin of this tentorium cerebelli. Then another structure is your posterior cerebellar artery, posterior cerebral artery. These three structures occupy this tentorial notch. Then through this tentorial notch only the things which are present in the supratentorial compartment are communicating with the infratentorial compartment, and the subarachnoid space between this supratentorial and infratentorial compartment is narrow in this area. When this narrow subarachnoid space is obstructed, that leads to one condition, that is the hydrocephalus. Due to the obstruction of subarachnoid space at this tentorial notch leads to communicating hydrocephalus. So hydrocephalus la neenga communicating and non communicating nu padipinga. Communicating hydrocephalus அப்படின்றது என்ன அப்படின்னா obstruction to the subarachnoid space in the tentorial notch area. இங்க இருந்து இது ரொம்ப நேரோவா இருக்கும். So these are all the important things you have to know about the tentorium cerebelli. So what is the free margin, what is the attached margin, and what are the structures crossing the attached and free margin union. Then next character, diaphragma cellae. So diaphragma cellae அப்படின்றது என்னன்னா, it is a structure which roof the pituitary fossa. So in the middle cranial fossa, here you will see the body of the sphenoid bone. Here the pituitary gland is resting over the body of the sphenoid bone. This hypophyseal fossa or pituitary fossa is roofed by another fold that is otherwise called as diaphragma cellae. This diaphragma cellae வந்து actually it is traversed by one structure, that is the infundibulum of the pituitary or pituitary stack. Anteriorly this diaphragma cellae is attached to the tuberculum cellae and posteriorly it is attached to the dorsum cellae. So இங்க பார்க்கும்போது ஒரு ரெண்டு சல்கஸ் மாதிரி பார்ப்பீங்க, ஒரு டிப்ரெஷன் பார்ப்பீங்க. ஆன்டீரியராக இருக்கக்கூடிய இந்த பேர் tuberculum cell, posterior இருக்கிறதுக்கு பேர் dorsum cell. So இந்த diaphragma cell அப்படின்றது attached with these two characters and it forms the roof for the hypophyseal fossa and it is pierced by the pituitary sac. So pierced by the pituitary sac அப்படின்றது it is an important MCQ. So diaphragma cell is pierced by which structure? That is the pituitary sac or tubercle of the, or ரெண்டாவது கட் பண்ணிக்குவீங்கல்ல இல்லை ஸ்லோ ஆகிட்டாலும் கட் பண்ணிக்குவீங்கல்ல ஓகே. So it is pierced by the pituitary stalk. So this is the important characters you have to know about the dural folds. Then next we will move on to dural venous sinuses. So see, this is different folds. This is the dura mater and this is the fox cerebri in between the two cerebral hemispheres. This opening is the superior sagittal sinus. Then next this is the fox cerebelli which project into the between the two cerebellar hemispheres, and then this is the tentorium cerebelli which separate the cerebral hemispheres from the cerebellar hemispheres. Then next dural venous sinuses. So the dural venous sinuses they are nothing but the space between the endosteal layer and the meningeal layer. So actually both the layers are fused with each other except at certain places, and that places you will see these sinuses. So the sinuses are characters which are lined by simple endothelium only. There is no smooth muscle and there is no valve. So that is the characteristic feature of a sinus. In the skull you will see many unpaired and many paired venous sinuses. So these dural venous sinuses oda work enna appadina, they drain the blood from the brain and also from the meninges and also from the skull. So here what are the paired sinuses and what are the unpaired sinuses? So paired sinuses nu paakumbodhu so ellame double ah irukka podhu. So first la irundhu paakumbodhu from the anterior cranial fossa, first thing is your sphenoparietal sinus which lies on the lesser wing of the sphenoid bone. So sphenoparietal sinus, then the middle meningeal veins, then this cavernous sinus, then the superior petrosal sinus and the inferior superior petrosal sinus and the inferior petrosal sinus, then the transverse sinus and the sigmoid sinus. These are all the important paired sinuses. And unpaired sinus அப்படினு பார்க்கும்போது, so here you will see the anterior intercavernous sinus and the posterior intercavernous sinus and the basilar plexus of veins, then the straight occipital sinus, then the straight sinus. These are all the important unpaired sinus. So singular இருக்க போகுது. So இவ்வளோ sinuses இங்கே இருக்கும்போது then another அங்கே நம்ம folds பார்க்கும்போதே பார்த்தோம் superior sagittal sinus and inferior sagittal sinus. So what are the unpaired sinuses na? Superior sagittal sinus, inferior sagittal sinus, anterior intercavernous sinus, posterior intercavernous sinus, basilar plexus, then the occipital sinus, then straight sinus. These are all the important unpaired. Paired sinus nu பார்க்கும்போது these are sphenoparietal sinus, cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus and the sigmoid sinus. So இது repeated கேட்கக்கூடிய 2 more question, paired and unpaired sinus. Sinus oda important clinical feature என்னன்னு பார்த்தேன்னா, this sinuses are communicating with the extracranial veins through one characteristic vein called emissary vein அப்படின்னு சொல்லுவோம். So the emissary veins are nothing veins which are connect the dural venous sinuses with the extracranial veins. What are the named emissary veins அப்படின்றது ஒரு 2 mark question. So இந்த mastoid regionல பார்த்துக்கிட்டேன்னா mastoid emissary veins இருக்கும். Then இந்த parietal regionல பார்க்கும்போது parietal emissary veins இருக்கும். Then in the here you will see one foramen, that is the foramen cecum. Through the foramen cecum வழியா ஒரு emissary vein வரும். Then next emissary veins which are passed through the foramen lacerum, then emissary vein which are passed through the foramen spinosum. So these are all the important emissary veins. So mastoidல, parietalல, then frontalல போயிட்டேன்னா foramen cecumல, இந்த middle cranial fossaல போயிட்டோம்னா foramen spinosum and foramen lacerum, then condylar canals வழியாகவும் சில emissary veins transmit ஆகும். All these emissary veins ஓட work என்னன்னா they are communicating with the extracranial veins and also with the dural venous sinuses. இந்த emissary veins ஓட characteristic feature என்னன்னா இதுலயும் valves இருக்காது. So அதனால blood flow வந்து it is possible in both direction. So they are the root or source for infection from the extracranial to intracranial infection. Then இத்தனை சைனஸ் இருக்குதுல இம்பார்ட்டண்ட்டானு கேட்கும்போது சில sinuses வந்து very important. இப்போ வந்து straight sinus னு எடுத்துக்கிட்டேனா sinus is formed by union of great cerebral vein of Galen and the inferior sagittal sinus. That is the important thing. Then next என்ன அப்படின்னா superior sagittal sinus and inferior sagittal sinusல superior sagittal sinus வந்து ஒரு இம்பார்ட்டண்ட்டான features. Because in the superior sagittal sinusல what is the characteristic feature அப்படின்னு பார்த்தீங்கன்னா see this is the superior sagittal sinus. In the superior sagittal sinusல the draining veins ன்னு பார்க்கும்போது many superior cerebral veins வந்து they are draining into the superior sagittal sinus. In the superior sagittal sinus on its lateral wall we will see many lacunae. What that lacunae அப்படின்னா they are nothing but the cleft-like expansion of the sinus wall. Here what happened, the arachnoid matter is project into this cleft-like spaces or lacunae. The projection of arachnoid matter into that cleft is otherwise called as arachnoid villi. Actually arachnoid villi is a microscopic structure. Once the age advances, what happens, you can see this arachnoid villi with the naked eye. So macroscopically these arachnoid villi projections are otherwise called as arachnoid granulations. So through this arachnoid granulation the CS of absorption will be improved. So that is the important feature of your superior sagittal sinus. And what is the another important feature of the superior sagittal sinus அப்படினு பார்த்தா here at the foramen cecum you will see one emissary vein சொன்னோம் இல்லையா. Through this emissary vein the superior sagittal sinus is communicating with the veins which are present in the nasal cavity. So any infection in the nasal cavity is transmitted through this emissary vein which is present in the foramen cecum to the superior sagittal sinus. That is why superior sagittal sinus is a repeatedly asking question. The next important sinus னு போயிட்டேனா your cavernous sinus. So cavernous sinus தான் very important sinus. நாம் already பார்த்த face classல நம்ம பார்த்தோம் there is a communication between the deep facial vein and the cavernous sinus ன்றத பார்த்தோம். So dangerous area of the faceல any skin infection இருந்ததுனா from there through the deep facial vein then to the pterygoid venous plexus, from the pterygoid venous plexus the infection is transmitted to the cavernous sinus அப்படின்றத நாம பார்த்தோம். So this cavernous sinusல நிறைய important clinical features இருக்கிறதுனால this is an important question and also clinically this is important. So this is the transverse sinus, so where it is situated. So the transverse sinus is situated in the body of the sphenoid bone on either side of the pituitary fossa. What is its extension? It extends anteriorly from the superior orbital fissure and posteriorly to the foramen lacerum or apex of the petrous part of temporal bone. So anteriorly it extends from the superior orbital fissure and posteriorly it extends up to the apex of the petrous part of temporal bone. And its length in பார்க்கும்போது 1 cm breadth and 2 cm length அப்படின்னு போட்டிருப்பாங்க. Then it has one medial wall, one lateral wall and one floor and one roof. So the medial wall என்னென்ன charactersனு பார்த்தீங்கன்னா the medial wall is related with the pituitary fossa which contains the pituitary. Then the body of the sphenoidல இருக்கக்கூடிய sphenoidal air sinuses they are going to form the medial wall. Then in the roofல பார்த்தீங்கன்னா you will see the internal carotid artery, it is going to form roof. Then internal carotid artery oda one more relation என்னன்னா it is present within the substance of the gland ன்றதையும் பார்ப்பீங்க. So it is present within the sinus and it also going to form one loop as a siphon tube னு சொல்லுவோம். Then it is going to form the roof also. Then anteriorly here it is related with the optic chiasma, then your optic tract, and the important relation is on its lateral wall. So laterally from above downwards or from superior to inferior what are the characters are related with the cavernous sinus now? In the lateral wall first the oculomotor nerve, then the trochlear nerve, then the first and second division of the trigeminal nerve. So 3, 4, 5. These 3 nerves, they are present in the lateral wall. From above downwards, first third nerve, that is the oculomotor nerve, then fourth nerve, that is the trochlear nerve, then the first division of the trigeminal, that is the ophthalmic branch, and the second division of the trigeminal, that is the maxillary nerve. These are all the 4 important cranial nerves which are related with the lateral wall of the cavernous sinus. Then laterally there is one more brain structure that is related, that is nothing but the uncus of the temporal lobe. Then within the sinus you will see another nerve, that is the abducen nerve, then one artery, that is the internal carotid artery. So internal carotid artery ku relation on the abducen nerve eppadi irukuna, it is inferolateral to the internal carotid artery. Then in the internal carotid artery, why it enter into the cavernous sinus, then it is going to form one loop. Inge pathina theriyum. So through the foramen lacerum valiya, the internal carotid artery along with its sympathetic plexus, it enter into the sinus, and then it is going to form one loop, and then it comes to its roof. So ஏன் இந்த கேரக்டர் இப்படி வருது அப்படின்னா, because in the embryological lifeல நமக்கு தெரியும் the common carotid artery ஓட continuation தான் internal carotid artery. So இப்போ common carotid artery is a branch from அயோட்டான்னு உனக்கு தெரியும். ஸோ ஆர்ச் ஆஃப் அயோட்டாலேருந்து வந்துட்டுருக்கு. ஸோ இப்போ டைரெக்டாக வந்து இதில் ப்ரெஷர் வந்து ஜாஸ்தி இருக்கும். ஸோ ஹை ப்ரெஷர் உள்ள ஒரு ஆர்டீரியல் இது டைரெக்டாக டக்குன்னு பிரெயின்குள்ளே என்ட்ரு ஆகும்போது பிரெயினால் அந்தளவுக்கு ப்ரெஷரை வந்து ஓவர் கம் பண்ண முடியாது. அப்படின்றதுனால டு dampen its pressure, the internal carotid artery is entering into the sinus and then it is going to loop. So to dampen the pressure effect to the brain காத இந்த கேரக்டர் இருக்குது. So even though the internal carotid artery present within the sinus நாம சொன்னா கூட, which structure is separating the internal carotid artery from the cavernous sinus na the endothelium of the sinus. So why you call this as a cavernous sinus அப்படின்னா, இப்போ நம்ம பார்க்கும்போதே தெரியுது. ஸோ இதனோட பேட்டர்ன் எப்படி இருக்குது அப்படின்னா, there are many spaces like cavernous spaces நிறைய அந்த சைனஸ்குள்ளே இருக்கிறதுனால தான் this structure is otherwise called as cavernous sinus. So இதனோட important relation, particularly the lateral wall is important relation. It is repeatedly asking 2 mark question. Name the structure which are present in the lateral wall of cavernous sinus. The 4 nerves, 3rd, 4th, 5th order first and the second division. Why the mandibular division is not forming its lateral wall அப்படின்னா, because once it arises from the trigeminal ganglion, this mandibular nerve it enter into the foramen ovale. So மற்ற எல்லாமே வந்து it is present in the lateral wall of cavernous sinus, and also maxillary division even though it is present here, இதுவும் வந்து immediately in the middle of the areaல it leaves the cranial cavity through the foramen rotundum. Then the remaining 3 structures எங்க போக வேண்டியது இருக்குது, இதனோட anterior எண்டா இருக்கக்கூடிய superior orbital fissureக்கு போகுது. So long course போயிட்டு இருக்கிறது என்ன அப்படின்னு பார்த்தோம்னா, நம்மளோட இந்த oculomotor nerve, then the trochlear nerve. These two, oculomotor, trochlear and the ophthalmic division of the trigeminal nerve, all the 3 structure they has to enter into the superior orbital fissure. Then the maxillary division is middle வந்து it leave the cavernous sinus and enter into the foramen rotundum, and the mandibular portion it is not going to form the lateral wall of sinus, it leave the cranial cavity through the foramen ovale. So these are all the important structures you should know along with the cavernous sinus. Then what is the reason for internal carotid artery enter into the substance and then this loop formation அப்படின்றது embryological reason நாம சொல்லிக்கணும். Then the abducen nerve is also present in the sinus. So name the structures present within the sinus அப்படின்னா, that is the internal carotid artery and the abducen nerve. This is about the formation and relation. Then next, what about its tributaries? Tributaries in பார்க்கும்போது, this cavernous sinus, this entirely drains the orbit and drain the meninges, and also it receives the blood from the brain. So இப்போ என்னென்ன characters, என்னென்ன tributaries எந்தெந்த ஏரியாலேருந்து வருது. So from the orbit, the main tributaries are superior ophthalmic vein and the inferior ophthalmic vein. Sometimes the central vein of retina is also drained into the cavernous sinus. So superior ophthalmic vein and the inferior ophthalmic vein and the central vein of retina, they are the tributaries from the orbit. Then from the meninges அப்படின்னு பார்க்கும்போது, the sphenoparietal sinus and the middle meningeal veins, these two are the tributaries from the meninges or vessels which drain the meninges and drain into the cavernous sinus. From the brain அப்படினு பார்க்கும்போது superficial middle cerebral vein and the inferior cerebral vein. This is the inferior cerebral vein, not the internal cerebral vein, because we are always confusing with this. நிறைய ஸ்டூடெண்ட்ஸ் தப்பா எழுதி வைப்பீங்க. So superficial middle cerebral vein and the inferior cerebral vein, these are all the veins which are drain the brain and enter into the cavernous sinus. So these are all the incoming channels. So once incoming channels முடிஞ்ச உடனே what are the outgoing channels? So outgoing channels ன்றது two characters. One is the superior petrosal sinus and another one is the inferior petrosal sinus. The superior petrosal sinus lastly drain into the transverse sinus and the inferior petrosal sinus finally draining into the sigmoid sinus. So these are all the outgoing. So outgoing to the only two characters, one is superior petrosal and another one is the inferior petrosal. So ஒரு incoming channels பார்த்தாச்சு, outgoing channels பார்த்தாச்சு. Next என்ன அப்படின்னா what are the communicating channels அப்படின்னு இருக்கு. So already நாம பார்த்தோம் communicating channelsல one is the deep facial vein which connect the deep facial vein is the connecting vein between the facial vein and the pterygoid venous plexus. From the pterygoid venous plexus there is one emissary vein which is going through the foramen lacerum and it is join the cavernous sinus. So from the cavernous sinus, one important connecting vein is the emissary vein which is passed through the foramen lacerum, then that is connected with the pterygoid venous plexus. Then another one is the superior ophthalmic vein. So superior ophthalmic vein also வெளியில நம்ம எங்க கனெக்ட் ஆயிருக்குன்னு பார்த்தோம், ஃபேஸ்ல வீனஸ் ட்ரைனேஜ் பார்க்கும்போது ஆங்குலர் வெயின் சொல்லிட்டு ஒன்று பார்த்தீங்க. ஸோ ஃபேஷியல் வெயினோட ஸ்டார்ட் பண்ணும்போது சுப்ரா ஆர்பிட்டல் சுப்ரா ட்ராக்லியர் தென் ஆங்குலர் வெயின்னு பார்த்தீங்க இல்லையா. தட் ஆங்குலர் வெயின் இஸ் கம்யூனிகேட்டிங் வித் த superior ophthalmic vein. The superior ophthalmic vein once again communicating with the this cavernous sinus. ஸோ அப்போ superior ophthalmic vein பார்க்கும்போது ஒரு இன்கமிங் சேனலாகவும் இருக்குது, ஒரு outgoing சேனலாகவும் இருக்குது. ஸோ this is a special character of your superior ophthalmic vein. ஸோ இது மூலமாக angular vein-லேருந்து இன்ஃபெக்ஷன் வரலாம். தென் pterygoid venous plexus மூலமாக through the emissary vein-னாலேயும் இதுக்கு infection transmit ஆகலாம். Then another important character is your basilar venous plexusல இருந்தும் ஒரு communication going to the cavernous sinus. Finally the basilar venous plexus are communicating with the internal vertebral plexus through the foramen magnum. So எல்லா பக்கமும் இது சுத்தி there is many communications. That's why cavernous sinus thrombosis is the commonest condition. Then another important clinical condition இங்க என்ன பார்த்தோம் அப்படின்னா within the cavernous sinus you will see the internal carotid artery இல்லையா. So the internal carotid artery இங்க இருக்கிறதுனால pulsating exophthalmos அப்படின்னு சொல்லிட்டு சொல்லுவாங்க. What is that pulsating exophthalmos அப்படின்னா there is a arteriovenous fistula between the cavernous sinus and the internal carotid artery. ஸோ அந்த மாதிரி ஒரு arteriovenous fistula ஃபார்ம் ஆகிறனால என்ன ஆகும் அப்படின்னா exophthalmos இருக்கும், பல்ஸுக்கு ஏற்ற மாதிரியே அந்த ஐபாலோட மூவ்மெண்ட் வந்து வெளியே தெரியும். ஸோ these are all the important clinical features you have to know about the cavernous sinus. So what is, where it is located, what is its extent, what are the relation and what are the tributaries, what are the communications and tributaries like incoming channels enna, outgoing channels enna. So everything, then lastly clinical aspects. So everything about the cavernous sinus is important. So far we have completing dural folds and dural venous sinuses. In the next class we are going to see about the another important questions from the head and neck region.